Diagnosis in Canada for chronic back pain and another 9 months waiting for surgery. She is hoping to prevent a similar situation for her son, who might have the exact same conditions. So, Lynn, the Canadian system just kept you waiting? What happened?
Well, after getting diagnosed with the condition that I have, requiring back surgery, needed a spinal fusion, it took me 3 years to get surgery.
Why did it take so long?
Well, to get an initial appointment with the first surgeon to talk about the potential surgery, that took 9 months.
Well, you said you had bad back pain. What did they tell you?
They said that I had a vertebra that was slipping over my pelvic bone. I was getting shooting pains down the sides of my legs. I lost feeling in some of my toes, the sides of my feet. I did no longer have the leg strength to keep myself upright. I started using canes and then walkers. Overusing pain medication to deal with all of this pain. I even ended up wearing diapers because the nerve that told me when my bladder was full was being pinched.
And throughout this, when clearly your situation was worsening, what did doctors say?
I was too young for surgery. I had not been on the wait list long enough. I had not suffered long enough. And there were people older than me and been on the wait list longer than me. And I wasn't even a candidate to get a date for surgery.
Never mind. Eventually you did, right?
I did. I did my
How long after your first visit to that doctor?
9 months.
Wow. And by then your situation had deteriorated.
Completely. I could not take care of myself. I was not able to take care of my kids. I couldn't even hug them. They had to climb on top of the dining room table so that I could give them a hug because I could not bend forward.
All right, now, lo and behold, your son could have the same condition.
Yes.
What's his prognosis?
Well, he does have the same condition. It could be hereditary. It could be from an injury.
He's 15 now.
He's 15 years old. He's just been diagnosed, so he's in the beginning stages of having the pain and the pain creeping down his legs. I, as a parent, cannot imagine sitting by and doing nothing.
All right, as the system in Canada goes right now, Lynn, what would happen or what would be the trajectory for your son?
I am trying to get an appointment with a surgeon for him.
And the same deal? You're waiting?
Nothing. I don't even know the name of the surgeon that is going to be offered to him. I can't, and nobody will return my phone calls. I can't get a date. Even if it's 9 months, 12 months, 16 months down the road, I don't have an appointment for him at all. And I can't watch for the next 2-3 years him deteriorate into the same condition that I was, waiting for the surgery.
Let me ask you this. The flip side of all this disaster stuff that you went through is that, well, in the end, while you had your surgery late, you didn't have to pay for it.
True, yes.
So people who advocate for some sort of nationalized health care or government-run health care or whatever we want to call it, that's a pretty good thing.
Is it worth the pain for 3 years?
For you, no.
No. No, I was not in a position where I could have even entertained the idea of paying for it for myself.
So friends and colleagues must have said, you know, if you go to the States, you might be able to get, that was not an option.
I hadn't worked because I hadn't been in pain for so many years. I was on welfare. I had no income. I couldn't work. As soon as I had the surgery, I spent a year rehabilitating, and I'm self-employed. I have a fairly good career. I have a nice house. You know,
You're in Vancouver. Right?
I am.
So you know, let me ask you, because the argument, and you and I were mentioning briefly during the break, that the system is great if you're not sick.
It's perfect.
Right? Because what's taken care of when you're not sick? Routine physicals?
Absolutely.
Everything covered?
Everything's covered.
And then if things get a little icky, then it gets to be a mess.
It can be. It can be. My son, you know, does have some other medical issues, and they are taken care of on a timely basis by excellent doctors. But a system that allows someone to deteriorate for 3 years in the kind of pain that I, and I'm sure many other people, have felt. I mean, you can lose your house, you lose your job, you can lose everything waiting for a surgery. So while there's many good parts, I'm sure, about the system, a system that allows this to happen, is something wrong.
The argument for doing something like what you've got in Canada, in this country, and you've probably heard it, Lynn, is a lot of folks are losing their homes because they can't afford to get the health care that you have granted you in your country, albeit late. What do you make of that?
Well, had I had a home and a job to lose, I would have lost it, waiting for the free care.
So your warning to us is what?
The system is not perfect. It's great if you're not sick. It's great if you have maybe some minor conditions. But if you are waiting for surgery, you are waiting until you're critical. And sometimes I've heard that wait is too long, and people
And there
die
are different
on the waiting
definitions
list.
of critical, right? I mean, you have to really look like a lost cause. Eventually, what got you that surgery? You were looking pretty pathetic, right?
The fifth surgeon that I saw was a younger surgeon, closer to my age, and he looked at me and he said, "You are too young, you have kids to raise, you shouldn't be like this. From your scans and your reports, I don't even know how you're standing up. I will get you in as soon as I can," and that was 9 months later.
But that surgeon seemed to move mountains
Yes.
to try to even get you that, right?
The other 4 surgeons I saw would not consider me for surgery, not consider me at all.
A lot of folks who love the Canadian system say yours is an exception, far from the rule. What do you say?
I don't think that's the case. I think there are a lot of people who have gone through similar, I mean, you hear stories of people, how people are dying on waiting lists. I don't think that's acceptable.
My best to your son, Lynn. Hang in there. Hope
Thank
he
you.
does well. He has a pretty good mom in his corner.
Thank you.
Be well. Lynn Gilbert, well, bad, but better than what we've got. Democratic consultant Tara Dowdle says, problems and all, this health care package is better than no health care package. Tara, this is a flawed package, though,